welcome to Community Corner, where United Way connects with local partners, agencies, and people who live right here to showcase the power of this amazing community. During this series, you will hear from inspiring individuals who have had to overcome incredible barriers, and from those who are driving positive change in community locally. Everything about this show is local, and we call that Local Love. So today we're being joined by Anna Carias, public health nurse, and Shauna Mutton, Vice President, Community Impact at United Way. And they'll be speaking with us today about the effects of financial supports, like the program called Financial Empowerment and Problem Solving. Now that's a long title, so we're going to refer to it as FEPS. And we're going to discuss the impact this program has on the lives of vulnerable people. So welcome, Anna and Shauna. It is so nice to have you here. We really we appreciate your time. So each year in Halton and Hamilton, more than $70 million of social benefits go unclaimed as a result of people not filing their taxes. So United Way convened partners over the past several years and launched a Phase 1 and Phase 2 of this FEPS program. So the partners include Oak Park Neighborhood Center, the Social Planning and Research Council of Hamilton, Hamilton Public Health Services, and the Hamilton Roundtable for Poverty Reduction. And these groups work together to really scale up this program locally. So FEPS is really a tax filing assistance and a financial education program, and it's helped residents out of crisis and into financial stability. It's really a poverty-based program, and a really strong collective. So Shauna, I'm wondering if we can start with you. You know, there are several people who do not file their taxes, and I'm just wondering if you can share with us some of the reasons why that might be.
Sure, thanks Brenda. The FEPS model, developed by Prosper Canada, enhances financial security through tax filing and improved access to benefits, while also building long-term financial literacy, which we know is so important. Despite the fact that people living in poverty receive substantial benefits during tax time, FEPS has found that people who attend multiple workshops have better outcomes, but most participants only attend one session. Our interventions utilize tax filing, one-on-one group education workshops, workshops with service providers, and online training modules. Tax filer data shows that in 2017, 19% of the 59,610 families receiving child benefits in Halton didn't receive them. This means there could be as much as $76 million in unclaimed child benefits in Halton alone. And in Hamilton, there's also similar trends, with tens of millions of dollars being unclaimed each and every year. It's
really interesting, right? And you know, there are several barriers, right? There's I understand that there's a lot of fear. You know, sometimes many people don't even have a bank account, right? So they think, why? A lot of times there are some newcomers and they're not sure which paperwork to collect as well. And so the interventions, I think, are really interesting. And so Anna, you have experience in health equity. I'm wondering if you could talk to us a little bit about, you know, poverty being a social determinant of health and how this program impacts that.
Well, thank you for inviting me. Poverty is a complex issue. It involves many different aspects of one's life and society as a whole. Every day we see, such as income, education, nutrition, unemployment, access to adequate housing, and lack of social support impacts the health and well-being of individuals and families, and in the long term, the health and well-being of the community. This can be illustrated by the idiom, a chain is as strong as its weakest link. Many people don't have resources and opportunities they need to remain healthy throughout their life. We know that the conditions in which people are born, grown, live, work, play, and age have an impact on the health and well-being. Adequate housing, nutritious food, employment, and education are strong predictors of an individual's health and well-being. And these social conditions influence our ability to achieve better health and maintain the well-being of individuals and the community. The financial empowerment strategy was designed to help individuals to work through and overcome barriers they may face so they can complete their income taxes, for example. And Shona mentioned that there are some unclaimed funds, and this is due to a variety of factors and life circumstances experienced by some people. They have not been able to access government benefits they may not be eligible for. Or they may not have obtained government documents such as a social insurance number or a birth certificate, and they may have never filed taxes, or they have not kept up to date their filing taxes, income tax filing.
Yeah.
Some community members are simply overwhelmed by the multiple barriers to completing all the requirements and access to these benefits.
Yeah, there's a lot of steps, right? It can feel very overwhelming,
Yes,
right? When you consider, all of the elements involved.
Well, and without these required documents and the awareness, they are unable to apply for benefits.
Yeah.
FEPS program works with people to problem solve on a one-to-one basis and refer the individual to appropriate services, help community members to obtain any documents they are missing, find out what government benefits and credits they are eligible for, such as GST credits and the Canada Child Benefit. Also help the individual file an income tax return throughout any time throughout the year, not just during the tax filing season. And also provide financial information and counseling, as you mentioned, Brenda. So throughout the financial empowerment strategy, people can then access the benefits and credits with these newly gained skills and increase the amount of income available to them and their family throughout available government benefits.
Yeah.
This can make a big difference for the income of a household or a family and allow them to have money for things that they may not have been otherwise able to afford. By increasing the income available, it also increases the opportunity for a family to assist with education costs, potentially leading to a more stable employment and a steady income, and the ability to afford adequate housing. An example of the government benefit, as I mentioned, is the Canada Child Benefit, which is a tax-free monthly payment made to eligible families to help them with the cost of raising children under 18 years of age. So individuals must file their income tax return every year, otherwise the Canada Child Benefit payments will stop.
Right.
So when society invests strategically in its residents, we are also collectively investing in a broader community.
Yes.
When people file their taxes, the community also benefits, and also the government benefits by receiving more revenue and investing in strong social service programs directed to reduce poverty.
And it can really impact the economy. So when individuals have access to more dollars, they're spending more dollars locally, and
Exactly.
and that's a pretty critical piece, especially at this point in time, right? In our community. So
Yes, it's important that you mentioned that, Brenda, because an increased household or family income means that people are able to spend those dollars in the community
Yes.
and help
Exactly.
the economy grow.
Yeah.
So this is a win-win-win situation
Win, 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 win.
for individuals, community, and society.
Yeah, absolutely.
Yes.
You know, it's, you know, when we think of poverty and it being a social determinant of health, we can also look at how that puts extra strain on the healthcare system,
Yeah.
which is already facing significant pressures. So I think connecting these and informing community on these two pieces and how they're interconnected is quite important. Now, Shauna, you know, Anna was saying that lives change, and I was wondering if you can share how the FETS program has benefited someone in the community.
Sure. I'll talk to you about Gord. So Gord is a local resident, has worked in theater, arts, and broadcasting, hosted a program on McMaster University's radio station, even managed a movie theater where his love of film was part of his everyday work experience. Yet, as important as entertainment and being a part of the artistic community have been to Gord, few people have more respect for the power of numbers, forms, and processes.
Yeah.
Gord's track record in entertainment is matched by his commitment to helping people who are living in poverty. A well-known activist and member of Halton Roundtable for Poverty Reduction, where fittingly he's part of the Speakers Bureau, Gord has seen how something as apparently routine as a tax return can impact lives. He is a vocal advocate and supporter for example, the Hamilton Tax Clinic, a partnership of United Way, the Social Planning and Research Council, and the City of Hamilton. The clinic operates in a number of locations throughout the community where volunteers provide free assistance to local families in completing and filing their tax returns. That kind of service is more than just an administrative helping hand. Gord points out that for people living near or below the poverty level, a properly completed tax filing can create access to some of the 41 different tax credits available to people in need. Like 41 different tax credits. The result is a vital reduction in taxes owing, and often a refund of precious dollars that would have otherwise been withheld. It's very important. Gord stresses this. It's very important, and if you don't file, you can't access the credits. So go out and do it.
Yeah, it can really be life-changing, and Gord's a great testament to that as a local senior who leans on credits for older adults. There's also a family that accessed one of the free tax clinics, and single mother, 4 children, and the outcome was tens of thousands of dollars. And we asked her, what are you going to do with the funds? And she said, I can send 2 of my kids to school. And this was a household that saw some intergenerational poverty. So that those credits are going to help to change the trajectory of that.
Yeah.
And so Anna, when we consider the pressures being faced by the healthcare system, can you share some insight into how the program helps the healthcare sector as well as individuals?
Yes, well, poverty and healthcare are strongly linked. Poverty, along with other factors like level of education, employment, housing, are all considered social determinants of health, meaning these factors and conditions have the ability to impact the person's health in multiple ways. If we can improve people's social determinant of health, they have a better chance for improved health outcomes. For example, since we are talking about income, individuals with higher income levels can afford to buy healthier food, they can pursue educational opportunities, and they can afford adequate housing. You can picture this, the social determinant of health, as a bit of a jigsaw puzzle, where the different determinants of health are interconnected throughout areas of people's lives and in the community. The more determinant of health that they are improved, the more likely it is that someone can achieve their full potential for health and improve their quality of life.
Yeah.
Another result is that they are less likely to require social and healthcare resources such as social assistance, coverage for prescription drugs, and access to food banks. This is especially important in times when these resources are less available.
Yeah.
Many non-medical factors and upstream interventions for addressing health equity and the social determinant of health, such as poverty, lie outside the scope of the healthcare sector. This is particularly important to remember that partners across multiple sectors work together to contribute to effective local strategies that decrease health inequities and improve the social determinant of health. For example, the FEPS strategy has multiple partners that work together to improve the health and the well-being of the individuals and the entire community. These partners include representatives from a wide range of community, financial, education, labor, legal, government, social, and health sectors.
Yeah.
Great.
Yeah, it is all interconnected.
Yeah.
It truly is. And, Shauna, I'm wondering, if you can share with us why it's important to support financial literacy and the filing of taxes.
Yes, I would love to, Brenda. I mean, the simple act of filing taxes can have a profound impact on the lives of financially vulnerable people. Filing taxes is really a gateway to accessing so many other benefits, including subsidized housing and daycare, city-run programs, and food banks. In fact, one is not able to apply for affordable housing unless they have an up-to-date tax return, which I think, Anna, you mentioned.
Yeah.
So this is one of the reasons vulnerable and low-income individuals and families need to file. Yeah, every year, low-income community members miss out on millions of dollars in benefits and refunds because they don't file their taxes. So through education and free tax filing, FEPS helps people out of immediate crisis. It also connects people with one-on-one counseling, group workshops, online training, and other services, which we've outlined before, earlier. So with these supports, United Way is helping individuals achieve long-term financial goals that make lasting changes in their lives.
And if I recall correctly, since the FEPS program started in Halton and Hamilton, I think to date, over $20 million of unclaimed benefits has now been received by individuals and households. So that's a real significant win, but there's so much more work to do, as I understand it. So,
Yeah.
So we are going to take a pause here for a moment,
Great.
and we're going to head out into community to join up with a United Way team member for an additional perspective on how poverty impacts our community.
It's Melise, here with United Way. I'm standing here in a local subdivision, and as I look around, I see family homes filled with buzz. What you may not see, and what most don't, is the most invisible poverty that rests behind some of these walls. Poverty limits an individual's or family's opportunity and access to healthy, fresh food, to childcare, to education, and to employment. Ensuring those most vulnerable have access to basic fundamental needs would lead them to a better life. Let's look locally, right here in Halton and Hamilton. People and families who are experiencing poverty and related issues continue to face overwhelming challenges. In some neighborhoods, women, part-time workers, and youth lost the most jobs during the pandemic. So what does this truly mean? It means that even though people are working and or wanting to work, the situation remains that in some cases, more than 25% of food bank users are the working poor. The working poor is a term representing people holding down work at or close to minimum wage. And earning minimum wage does not represent a living wage. Community also considers the ripple effect of poverty. When children go to school hungry, it plays a key factor in their ability to learn, impacts behaviors, mental illness, and shame. Yet, one thing that remains true is that community and donors are dedicated to build and protect the social safety net so people don't fall between the cracks. The past few years has affected children and families significantly. Without targeted supports, these young people are less likely to live up to their potential and more likely to have poorer outcomes across different life domains, such as social, academic, and professional. We know that children who receive early learning supports are more likely to graduate from high school. So why does this matter? Well, high school graduation rates are a key marker in breaking the cycle of intergenerational poverty. As you may know, many of the families that United Way funded programs serve struggle with financial challenges that preclude anything but the basics: a roof over their head and food on the table. We know that children living in poverty are less likely to do well in school and graduate high school. It is with thanks to people in our community, your United Way can invest in emerging needs and engage in collaborative action with partners to build capacity and resources across the social sector in Halton and Hamilton. Thanks so much for joining me here in this local subdivision. As in past episodes and in future episodes, we're keeping it local. Please stay tuned for today's guest performance, a local artist dedicating their talent to bring community together. I'm sure you will enjoy it as much as I will.
Your body when I wanted you to hold me at 30 a.m. by your side. Ain't feeling quite the same since what we had died. And it hasn't hit me yet. Well, I feel it coming.
And welcome back. We hope that you enjoyed that performance as much as we did. So filing taxes is a yearly occurrence, yet for many, the process really creates, a lot of high anxiety and drives procrastination. And 1 year of missed filing can then turn into 2 and 5 and then 10 years. And so, this program is only able to come to life as a strategy because of the commitment of this community and the commitment of generous residents. And so another important element is that the Ontario Trillium Foundation was a key funder and supporter in this, and this program and initiative could not come to life without the Ontario Trillium Foundation. Last year, more than 200,000 residents relied on 160 United Way supported programs to help them deal with these issues, and some of them are old issues, old problems such as poverty. And then you add into that the new pressures of the secondary pandemic, the echo pandemic, the shadow pandemic of mental health. And so, take great pride in the resilience of this community and the commitment that it has for caring for one another. So thank you, Shauna, and thank you, Anna, for being with us here today. We really appreciated your insight and enjoyed your good energy. And thank you also for joining us, and we'll see you next time at Community Corner.